Hi all, welcome. And in today's video, we are going to discuss everything you want to know about Medicare supplement plans. So if you're someone who's trying to get into Medicare or want to understand more about Medicare supplement, then please make sure you stay till the end. We are going to discuss what are the different kind of Medicare supplement plans, what are the differences between Medicare supplement and Medicare Advantage plan, and some of the features of Medicare supplement and why you should consider it and whether it is right or not for you. Please make sure you stay till the end, and don't forget to like and subscribe this channel. Today we have Larry with us, and he's an expert in Medicare, and today we are going to learn about Medicare supplement plan.
Well, I greatly appreciate you having me on today. We'll do a high level. We won't dive too deep into the supplement as far as the details of particular companies and things like that. So we'll just do more of a high level. So we'll pretend that we're all starting here, turning 65, and we have our choice, and explain how the supplement works and why people choose a supplement over an advantage plan and vice versa. So when someone turns 65, there's a couple little things. We'll just start from the very basics. We won't assume anything that anyone listening is going to know anything. So they're turning 65 in November. And so 3 months before November, we'll go back, what's that? October, September, August. Starting in August, they can apply for Part A and Part B. It will be effective 11/1. So now they have their effective A and B 11/1/2023, and we're sitting here in September. They already did their work. They have their card in hand, and now they're trying to figure out what to do. So if they just stay in traditional Medicare, that would be using your red, white, and blue card. What you would go to your doctor, and you would pay a deductible of $226 in 2023, and then you would be on the hook to pay 20% after you meet your deductible. So anyone who chooses to stay should go into a Medicare supplement. There's a bunch of plans, Plan A through N, of Medicare supplements, but just to keep things simple, I'm going to focus on two of the more common ones for 2023. With one little disclaimer, Plan F was a pretty popular plan up until 2020, and there was a new regulations that came across that were effective in January 1st, 2020. So if someone is turning 65 after January 1st, 2020, they are not eligible to choose a Plan F. And a Plan F basically covers that deductible we just mentioned, and it covers the 20%. So someone will pay a premium, and then Medicare is billed for their part, and then the supplement pays. Anyone who turned 65 prior is eligible to stay in the Plan F and to move to different Plan F if they qualify medically. Just wanted to get that out there. So sometimes there's misinformation that you can't get a Plan F. You can if you turn 65 prior to January 2020. So today in 2023, the more common plans are Plan G and Plan N. Those are the two you see a lot of. Plan G is really simple. The only thing it doesn't cover is the Part B annual deductible of $226, which is the number for 2023. That number changes from year to year. CMS will determine what that number is for 2024. right now, $226. So you go to the doctor, you give them your red, white, and blue card. They you pay your $226, and if the bill is over $226, then they bill your Medicare Supplement Plan G. Now, I'm going to take a step back and I'm going to explain that Plan G is regulated by the government. Any insurance company that offers a Plan G has to cover whatever Medicare covers. So they can't pick and choose. Sometimes people think that, oh, if I go to a different company, they may not cover me anymore. That's not true. It's federally regulated. It says it in the Medicare handbook, the Medicare and You handbook. So what becomes a big factor with determining a plan is a couple things to look for. One is the price. What is the price for Plan G supplement? Now, sometimes there's companies that start with lower prices, but yet they have major increases as time goes by. So there's a history of the increase, a lot with that can be tracked, that we know certain companies have a higher increase rate than others. So those are important details to know, like which company is stable, where my rates may only go up 3 to 5% versus 8 to 12. And it's all based on county. The county and the states that are in have different pricing for a lot of the companies. So all of that becomes a factor. Now,
sorry, Larry, one quick question. So how can someone figure it out that, what is the rate increase for a particular insurance company? What is the historic rate increase? Is it something available, or only agents will know based on experience?
Well, a lot of the quoting tools that insurance agencies use will actually show the history. It'll show the rating of the company, and it'll show the history of increase and how long they've been in that market. So usually having a broker or an insurance agency who has access to multiple companies and a quoting tool, that will be able to get that information.
Okay, great.
Okay.
Thank you.
Now, one quick thing that's really important to mention when we're talking about Medicare supplements, and that is when you turn 65, and we used our example early on as November 1st, 2023, client goes on Medicare, turns 65. From that day, they have 6 months. They have a 6-month open Medicare supplement open enrollment period, which means no matter what their health is like, they are automatically accepted. It's one of the few times that they can go into a plan without a Medicare supplement plan. There's no real underwriting in a Medicare Advantage, but in a Medicare supplement, there is underwriting, except for those first 6 months. That Part B they can go into. So, for instance, if someone is recently diagnosed with cancer, and they know they're going to have a lot of expenses, and they're not even sure which doctor they're going to use, they might want to consider a supplement because they can't be disqualified because of their health. Again, 6 months from the turning 65 date, they can go into one without any health questions. Once that 6 months has passed, they can only, once that 6 months has passed, they didn't make any choice at all, and they just stayed in traditional Medicare, they can pick up a supplement, but only if they qualify medically. And each company has their own questions, but for the most part, if someone has cancer, if someone is taking high doses of insulin, people take it on oxygen. There's going to be a lot of different conditions like that, COPD. There's very few companies that will accept someone when they can be underwritten. So that's important to know. And then there's also something called a trial right. And a trial right means that if someone from the beginning starts into Medicare Supplement, and when I say beginning, from when they started on Medicare, their Part A and Part B start date, and they had a supplement, they have a trial right, meaning that if they leave and go into an Advantage plan, they have a year to come back into that supplement with no questions asked. Now, it's only the original company, and they can only go back to the company they were in, and they have to prove that they qualified, had all the qualifications for a trial right. So that's just a little side note. Doesn't come into play a lot, but sometimes it does. Now, if you have a supplement, I know this is about supplement, but I just want to finish, I guess, the puzzle. If you stay in traditional Medicare, you would have your red, white, and blue card. You go see your doctor. You pay your $226 deductible in the Plan G that we're talking about, and then the doctor and then anything else the Plan G is the supplement will cover. And then let's say your doctor gives you a prescription. Well, then you're going to want a standalone drug plan, because if you just take a supplement and you don't pick a drug plan, you really only have 63 days after your Part A start date to get one without getting assessed a penalty, a late enrollment penalty. So those are just details. Now, if you had credible coverage through a group plan or through VA, for prescriptions, and they were considered Medicare credible coverage, then you're okay. Then you can still go into one. You just have to prove that you had credible coverage, so you're not assessed a penalty.
Okay.
So G is the most common one. The other one is N. So sometimes I can just tell from the broker side. I know brokers who like the Plan N because it's a little bit less expensive than the Plan G. And if someone's is pretty healthy and they just go see their doctor once or twice a year, the premium could be low enough compared to the G that it just makes sense. And really the big difference is that they both pay the $226, and then when they go see their doctor on a Plan N, they may have a small copay up to about $20. So those are the two main ones that you hear a lot of people talking about. They're not the only ones. Some of the other plans will cover excess charges. So what that means is, let's say a doctor does not take a traditional Medicare billing. They'll take Medicare, but they won't take the reimbursement rate. So you come in there, you go to see that doctor, and then that doctor bills Medicare. Medicare pays their allotted contracted amount, but then the doctor wants the balance bill up, and Medicare says they can do that up to 15% of the Medicare charge. So some of the supplements cover the excess charge. Now, that's something in the state of Ohio, it's illegal. In other states, it's illegal to have an excess charge. So it doesn't become an issue in a lot of states. But it is important, if you are in a state that allows it. And again, working with someone who knows the market, the local market, who's an agent, insurance agency, and a broker, they're going to know that. And if not, it is fairly easy online to look up which states allow that balance billing access charge. So some of the supplements do cover that. So there's things like that.
Okay. So one thing, like to summarize, like Medicare supplement plan is used to kind of pay for additional expenses which may come out, and which Medicare or original Medicare is not paying. So I think let's quickly maybe compare or list some of the things which Medicare supplement and Advantage have kind of differences. Well, these are the two main things which you can go
Sure.
once you have Medicare. So if you don't mind, Larry, I'll list some of them, and please feel free to add on top of it, or
Yeah, absolutely.
So one thing which I know is like the cost. So in Medicare supplement, generally you have a premium which you have to pay on top of your Plan B premium, and that may be significant. In some cases it may be say 200, 400, whatever dollar per month. But in Medicare Advantage, you may even get a $0 premium plan where you don't pay anything, or a fairly reasonable premium. So cost becomes is that one difference which I have seen.
Yes.
Another difference which I am aware is that in Medicare supplement, there is no dependency on networks. You can go to any doctor who takes Medicare. But in Medicare Advantage, sometimes if you have say HMO plan, you can go only to the network. In PPO, you may go out of network, but you may end up paying a little bit more. So that is a difference, and that's why some people who are able to pay a high premium, they go towards supplement because there's no dependence. You can see anybody, and in some situation, right, you're staying, you live in particular area, but you have some disease and you want to see a specialist who's outside and all. So that may make sense or be a better choice. Third thing, which like is there is no pre-authorization or pre-qualification required for Medicare supplement. So I mean, if there is some procedure which your doctor is suggesting, you can go ahead and Medicare supplement will pay for it. But in case of Medicare Advantage, in some cases they may go for pre-authorization, where insurance company has to approve that, whether it's medical necessary or not. In most of the cases, if it's really reasonable, right, you will get approved in Medicare Advantage, and that should not be a challenge. But just if you need that flexibility, and these are kind of major differences which I have seen. But Larry, do you want to add anything else which I may have missed, or add to these things?
Yeah. I mean, that is right. Now I've been told by a home health agency in the last couple months that traditional Medicare is beginning to hire the same third-party prior authorization companies that the Medicare Advantage are using, and that they are starting to see Medicare actually require some of that, especially for things like skilled nursing, home health, things like that. But as a whole, you're absolutely correct. I mean, that is exactly a big difference in is the network. Now, I will just add this, so if somebody, the cost, you mentioned the cost first, and cost can be relative because it's not the whole picture of what you're paying monthly. Is not the whole picture versus not paying. So let's use an example of two different people, somebody on a traditional Medicare with a supplement, the other part of the cost that we need to always be mindful of when you choose a supplement is you have to pick a standalone drug plan if you don't have credible coverage through VA or some other place. So that's also another premium to look at. So I'm a really big fan in each case that you take a look at medication costs, deductible, like a lot of the Part D standalone drug plans, a lot of them have a deductible for medications that are tier 3 or higher. Now, compare that to a lot of the Medicare Advantage, and again, I'm talking mostly from my experience in my market in Ohio, that could be different in every area. You do have to look at it, the details differently, but a lot of the Advantage plans do not have a deductible, and the Part D plan is built into the plan. So I like to take a look at, if you stay in a traditional Medicare, like you alluded to the cost, no matter what, you're going to pay your Part B premium unless if you have Medicaid, or some plans do give some of a Part B give back benefit built into the plan. But outside of those two, you're going to be paying that. But the Advantage plans are the one giving the give back, not the supplement. So, but let's just say equally, you're paying $164.90, which is the standard normal rate. Now, some people pay a higher rate depending on their income. They may pay a higher Part B premium. And then you got to pay for the supplement. Okay, so now you're paying the supplement, and let's just say an average supplement is, just for easy math, let's just do some easy math and say it's $125 a month. So you're paying $125 a month for the supplement, and then let's just say you're paying $25 for the Part D standalone drug plan. So that's $150 you're paying each month, which is $1,800 you're paying. If you go to the doctor, you don't every year, and that as we talked about earlier, that's going to go up 3%, 5%, 8% every year. That 125. But you know that, hey, if you go to the hospital, you go anywhere, the most you're going to pay out of pocket that year is your premium plus $226. So using the case we just talked about, the 125 and the 25, 150 total premium above and beyond the Part B, that's $1,800 plus $226. That's $2,000 is what your potential to pay max out of pocket, if potential max out of pocket on the medical side. If we go into the Advantage side, and like you alluded to, and we pay $0 for the premium, and we're just paying our $164, that's $150 we're not paying in premium every month. But every time we go to the doctor, we're going to pay a copay. And the Medicare Advantage they don't have a deductible. Well, some of them have a deductible, especially the PPOs if you go out of the network. But as a whole, most of them don't have a medical deductible, but they have copays. So every time you make a copay, it is subtracted from the maximum out of pocket, the MOOP, often called in the insurance industry. So if we have a plan that has a maximum out of pocket of $3,500, well, now we know $3,500 is the absolutely most we could possibly pay on the medical side. That's excluding prescriptions. We're just talking A for hospital and B for medical. Now we do a comparison of, okay, I'm paying $2,000 on the supplement if I'm sick or not, I'm paying 0 on Advantage, but the worst case scenario on the Advantage in a given year is $3,500. Well, on top of that, a lot of the Advantage plans have some additional benefits. They have things like Silver Sneakers memberships. They have some of them have
Dental,
food
vision.
cards,
Yeah.
over the counter, dental benefits. So again, I like to look at the whole picture, and there's no right or wrong answer. I mean, sometimes, unfortunately, on the internet, we have people that are saying, "Oh, only Advantage is the best way to go," and other people saying Advantages are no good. And there's no right or wrong answer. And a good advisor will just educate and let the client decide how they want their Medicare health benefits administrated. Do they want it through traditional Medicare, or do they want it through Medicare Advantage? And really getting into the details of that person. Every single person is sort of just these different pieces to a puzzle, and a good agent should be able to put those pieces together to form the perfect puzzle that makes the picture they're looking for their health needs. And unfortunately, not everyone thinks like that, but that's really the best way to approach it. And we should be educators and not trying to sell people a certain plan or not.
True. No, I agree with you, Larry. And that's the purpose, right? We want to educate people so that they can take the right decision. And one thing which I forgot to mention for supplement is sometimes they have this benefit for foreign travel also. That if you something happens to you when you're abroad, it'll pay, I think, up to certain amount. Again, it depends on the supplement plan, but that is something which may not be part of some of the advantage plan. That's so I think if we have to take few examples, right, real life scenario. So different situation, you may choose a different plan or option. So for example, if you are someone who's really wealthy, you have enough disposable income, you travel a lot, maybe you go to abroad and all, then Medicare supplement might be okay for you. You're not worried too much about the higher costs, and you have all the flexibility you need. But on the other side, right, if you are someone who has a limited means, like you have, say, maybe $1,000 per month of income, then it may not make, and you don't travel. I mean, you are at a particular location, and many times, right, people after a certain age, they want to prefer to be at a place where they're near their loved ones and whatnot, right? So for you, Medicare Advantage might be a better option because it's first less cost, but has a lot of additional benefits, um, and things which you get. So there are different spectrum, and as Larry mentioned, right, like if you have, say, some kind of a disease, like you have cancer, you're turning 65, then maybe Medicare supplement might make more sense. You may want to see specialists across the country, or have a lot of other kind of expenses. So I mean, it depends on your situation, but these are broad spectrum, and by working with the right advisor or agent, you can figure out what's the best value for money in your case. So anything else, Larry, you want to add, or
Yeah, I'm just going to add one thing about the traveling.
sure.
There's a couple of things. First of all, some of the Advantage plans do have a international travel benefit. Some don't.
Okay.
You are covered in the case of an emergency with all the Advantage plans. So unless you're seeing doctors that are, in other states, sometimes we have the snowbirds that, leave the northeast and go down south for the winters. And sometimes they have, doctors in both places, sometimes not. So a lot of the Advantage plans now do have a national HMO network as well. I have clients that are in Ohio and they go to Arizona in the wintertime. And they're actually on an Advantage plan. That's an HMO that both are their doctors. The husband has heart conditions, and he has a heart doctor in both the Cleveland Clinic in Cleveland, but he also has a heart doctor that he sees when he's in Arizona because he's there 6 months, and then he's back. And so we actually found a plan that's an HMO that had both his doctors in network, and he was in a plan that he didn't even have to notify the company that where he was at. As long as they were in the national HMO network, he could go see them. So they're
Awesome. Okay.
so they're everyone that covers in the states emergency, and then some even put urgent care under that same umbrella as emergency. So
True. No, thanks for sharing that. I think Medicare Advantage plan are getting more attractive day by day. Maybe a few years back, they might have a lot of restrictions and limitation, but as you mentioned, right, networks are getting more expanded, and as long as you select the right plan, you may get a good coverage. So thanks for sharing that. So yeah, I think that's, I think to summarize, right, like we discussed uh, Medicare supplement and some part of Advantage. So it's based on your situation, what's right, and that's how you should go rather than having only one product which is right or wrong. I hope you were able to find some value out of this video, and it made you um, understand the differences between Medicare supplement and other kind of option. If you want to know more or need help in selecting the right Medicare plan, then go to coverclan.com, and there either you can book an appointment or select the right plan yourself. So don't forget to like and subscribe this channel. And if you have any questions, please feel free to leave in comments. Thank you.